Hi, my name is Dr. Samuel Pegram, and I would like to welcome you to the living room, RHEUN room, as in rheumatology, a place where we discuss rheumatologic issues from the patient's perspective. Today we're going to talk about steroids. I would argue that there was no greater advancement, pharmacological advancement, in the treatment of rheumatologic illnesses in the 20th century than the advent of steroids. I would also argue that there is no word that is used with greater trepidation in the 21st century than steroids. In 1948, the first patient with rheumatoid arthritis was given cortisone. And in 1955, the first synthetic cortisone, prednisone, was given for the use of treatment of rheumatologic illnesses. Rheumatologists finally had at their disposal a very powerful and effective medicine for inflammatory conditions, and it had all the trappings of everything that a rheumatologist could wish for. The medicine came in a pill form, so it was easy to take. It was inexpensive. It also was rapidly effective. It also came in a whole bunch of flavors, meaning that we could give it in creams, we could give it in pills, we could give it in injections, we could give it intravenously, and they all worked. We were like kids in a candy store. We finally had a drug that was effective, worked quickly, and was very powerful, and we used it a lot. We used as much as we could and for as long as we could, because patients literally who could not walk, now with the advent of cortisone and steroids, could walk. Patients who had inflammatory diseases of their lung, which before relegated them to hospitalizations and the use of oxygen, no longer required it. And patients who had refractory skin rashes and other lesions that did not get better with topical agents now were better. So we were thrilled to death. But as we continued to use the steroids, we subsequently noted that there were a number of side effects that came with it. So I guess there is something called too much of a good thing. Patients who were on steroids began to gain weight. They would gain puffiness in their face. They would also have bruising of their skin and poor healing. We noticed that patients who took long-term high-dose steroids would have emotional issues. They were often depressed or anxious, often couldn't sleep. We found that the steroids caused a number of problems with their eyes. They developed rapid onset of cataracts, and often their glaucoma became much more difficult to attend to. We noticed that patients on long-term steroids also developed muscle weakness, even though we were using the drug to treat certain issues of the muscle. We realized also that our patients on steroids who unfortunately developed infections had a much more difficult time getting rid of those infectious conditions when they were on high doses of cortisone. So all of a sudden, all of the happiness we had with the steroids was tempered to some degree because it came with a price. Steroids are never something that patients should be afraid of. Steroids are excellent drugs in the 21st century when they are used appropriately. Steroids are rarely the mainstay of therapy in any rheumatologic illness long term. They should be considered adjuncts. They are to help out, get the burden of disease down where other medicines, which we call steroid-sparing drugs, can take its place, that have less side effects than the cortisone or steroids over long term. They also should always be tapered to the lowest dose necessary to maintain control of their disease. Standards of care generally dictate that we try to keep oral prednisone at a dose less than 10 milligrams per day, which we would prefer in our practice to keep it much below that at 5 or 7.5 milligrams per day, and if at all possible, every other day dosage or off. Doesn't mean, again, they're not good drugs, but they must be used appropriately. Also, patients should never abruptly discontinue their steroid dose. Steroids are always tapered on a regimen that is given to you and a tapering schedule given to you by your rheumatologist. When steroids or cortisone are used effectively in conjunction with other steroid-sparing drugs, steroids are quite effective, and they should still remain a most important ingredient in the treatment of most rheumatologic issues. But our goal in the 21st century is to use as little of the steroid as possible. We look forward to you next time as we get back together here in the living room. And I want to remind you that steroids, again, are good things to have, particularly for doctors when we tell you that we're going to put you on steroids. We'll see you real soon.